Okay, hi everyone. Welcome to the MaxLove Project podcast. Today we have kind of our first intro to our Ask the Expert series. We have Lexi here, our dietitian here at MaxLove Project, and we have our social work graduate intern, Jeni Rhodes, here as well as the parent perspective. We've had a lot of questions in the MaxLove Project Connect app through our Ask the Expert series around bone health. So we're going to try to dive into that topic today. We have Jeni here, who is an expert on the topic as well from the parent perspective, I would say. So first, Jeni, if you'd love to introduce yourself, we've had you here for a couple months now. If you want to give, our families and our audience a little intro about yourself, your daughter, whatever you feel open to sharing, that would be great.
Sure. Hi, everybody, and thanks for having me today. My name's Jeni, and I was in a Master's of Social Work program at Boston College, studying to be a therapist. And then midway through the program, my daughter, Anya, who was 7 years old at the time, in January of 2022, was diagnosed with osteosarcoma. So that is a bone cancer specifically. And when that happened, I went on leave from my program and focused in on being there with her. Luckily, we at this moment are a couple years post treatment, and so I am here back in my program. Going to be a therapist. I offer one-on-one emotional support through MaxLove Project to parents, and I'm excited to be here with Lexi because I have, from a parent perspective, a lot of questions, and I know I've received a lot of questions about bone health as well.
No, thank you for that intro. I think that's, I think your role in MaxLove Project now is so vital, and it's so inspirational that you felt the courage to go back to, what you were trying to do before your diagnosis. And I'm sure you're bringing so much over now. Do you feel that like you have so much more to almost offer because you can feel that with parents based on what you've been through with Anya?
Yeah, I think when I went on leave, I was like, oh wow, I'm about to get schooled in life, and I think very much that was my experience. That there were a lot of hard spaces, and there was a lot of learning, and the learning continues, right? Like, I guess the big takeaway that was a little surprising to me, and has been surprising to others, is some of the spaces for nutrition, or some of the spaces that the information hasn't been as easy to access. And then as treatment ends, kind of a surprise that like, oh, the stress continues for many or most of us. And we continue to seek out information to be there to support our kids best we can. So.
No, we're so lucky to have you. And I think you can bring so much as an osteosarcoma mom. And I think that's one question I have, I'm a brain tumor mom, is bone health doesn't have to do with just a bone cancer diagnosis, correct? It's also treatment related. So a lot of the treatments can impact bone health. That's an ignorant question for me of what is that space of bone health in relation to pediatric cancers? It's not necessarily just a bone cancer diagnosis, correct?
And I think this will be a great place for Lexi.
Yeah. Yeah, you're absolutely correct. There's so many different chemotherapies that affect so many different parts of bone health. So it does spread itself out amongst all the different types of cancer there. When we think about bone health, there are three really important cells that are integral to how bone health is made. And so we're constantly recycling bone. In fact, it's said that every 10 years we grow completely new bone. So the body is constantly remodeling bone. You have something called osteoclasts, which break bone down and repair it. And then you have osteoblasts, which put new bone together. And so it's easy to remember that when you say blast, I picture a little construction worker just sort of spraying down new bone. Osteoclast, I see him doing a sledgehammer, kind of breaking down new bone. There's also osteocytes, which are cells that recognize and sense the damage that's being done to bone, and like little micro breaks that happen, and send out information to the body that the osteoblasts need to get going, the repair process needs to start, and the formation of new bone needs to start. There are definitely parts of the body that are important in there. One is the brain, just like you talked about, Samantha, where the pituitary gland is the part inside the brain that sends these messages that we need to produce more bone or we need to remodel new bone. But there's also influences that come from hormones like estrogen or hormones like cortisol. So stress hormones absolutely inhibit osteoblast formation. When we don't have enough estrogen, estrogen also tells the body to lay down new bone. And we know that several different kinds of chemotherapies affect both of those processes, the pituitary gland and the communication, the inflammation piece with the cortisol happening, the estrogen piece absolutely works together to tell the body what to do in that process. I have a couple of different chemotherapies that I've written down that specifically inhibit, for example, carboplatin. Carboplatin induces the trabecular matrix of bone, which is that honeycomb portion of bone, that it inhibits that. So it breaks it down. And doxorubicin, it can reduce calcium levels in the body. Cisplatin can also reduce calcium levels in the body. And a lot of different chemotherapies are called alkylating agents. And all of those can induce side effects to the gut, but also they can induce the bone marrow to stop producing new cells, which is the effect of chemotherapy. You want to stop the growth of cancer, but it also stops the growth of bone. And so when we think about what the gut does for bone health, the gut is integral in so many ways. And there was a really incredible study that was done out of UC San Diego that showed that almost every patient undergoing any kind of chemotherapy and radiation has damage to the gut microbial system. So it decreases the diversity of the gut bugs, but it also decreases the abundance of the gut bugs. And gut bugs are so important because the collection of good gut bugs that you have in your gut, it actually can support the immune system in functioning properly. And that also regulates those bone marrow cells. It regulates also inflammation, because too much inflammation, too much cortisol, too much stress hormone can inhibit that bone formation. Gut microbes also regulate growth factors in the body, telling the body to lay down new bone. And it helps to metabolize properly the estrogen and the other hormones like thyroid hormone as well. So if we know that chemotherapies have direct action against the nutrients that are needed for bone, as well as the growth factors, as well as the hormones, but then has direct influence on the gut, it's all of that is affecting the way the body can lay down bone. So that was a long explanation, but that just permeates through all the important parts of how bone is laid down and how the process of treatment for cancer influences it. Radiation as well. Radiation absolutely influences the way bone is laid down.
No, I think that's helpful. And to me, it sounds systemic. Like that's kind of the way I would, how
You're absolutely spot on.
Yeah,
it affects so many parts.
Yeah. No, and we'll have the show notes too here. So if that was a lot for anybody listening, you can check out the show notes with links and the lists of chemotherapies and things like that. So that will be there as a tool as well. And now I'm going to hand it off to Jeni as, the parent perspective. I know we've mentioned that a lot of this nutrition support to help bone health isn't necessarily a talking point in an oncology office. So I'd love to hear, the kinds of questions that families have for an expert nutritionist like Lexi.
Well, I think that one common experience, one that we had, unfortunately, and kind of one that I hear repeated, is while the chemotherapies can have an impact on bone health, I also ended up kind of discovering, or Anya discovered, when she had to have her leg amputated. She had a unique amputation called rotation plasty. So that also involves a refusing of bones. There are different choices that people make, but oftentimes in the healing process, they need the good supportive bone health for the bones to refuse. And in our case, we didn't experience complications with the fusing piece, but I know a lot of parents are interested in supporting through nutrition, that process of the bone fusion. For in our case, one question that comes up for us is that so Anya was in a wheelchair for a really long time. She was not weight bearing. And then even when she did have the prosthetic and was starting to walk on it, she was sick. It was a very long chemo regimen. And so she wasn't really putting a lot of pressure, and kind of my understanding is sometimes just like walking and kind of the bone getting exercise also strengthens it. And so about 1 month post chemo, she took a very small fall from sitting. She was sitting, she pushed up and her foot slipped and she fell, and she ended up with a fracture from that very slight fall. And that is when we discovered that in the leg that had the surgery, she had osteoporosis. And I guess at that point, the treatment that we were told was vitamin D, increasing her vitamin D and increasing her calcium. And so I was left feeling, and I think many parents kind of feel like if she had all the risk factors and she was not weight bearing, then could we have brought an increase of calcium and vitamin D earlier on as more of a preventative measure. And so I am curious as for myself, like kind of in retrospect, and for parents who are going through it now, and for those who have it waiting for it to fuse, how would you recommend us supporting that bone growth through, my understanding is vitamin D and calcium? How do you get that into the kids?
It's a great question, Jeni. It's a fabulous question. And it also brings up a lot of different side topics. As I'm listening to you, I wanted to answer it this way and this way and this way. When we go through the chemotherapies and the whole entire treatment protocol, there are several things that are put on hold, for lack of a better word, while you're focusing on the most important part, is to try to eradicate the cancer and get somebody back to complete health. During the treatment, the best nutrition possible is going to minimize the side effects as much as possible. It's also going to make us feel a little bit better so that we can continue to receive the treatment that is life-saving. And so there are very specialized physical therapists that work only with osteosporosis. So if we know that we're undergoing a treatment or undergoing a situation, exactly like you said, of inactivity and also feeling incredibly sick and not able to eat the foods and things that might be the most optimal for us, it represents a challenging situation that needs multi-disciplines to help. So you need that physical therapist that is specialized in somebody who's had to have an amputation. So how do we do impact exercises on the remaining limbs so that we still exercise the part of the bone that's there and do it in a way that's not going to cause more pain for the child, because we know that more pain, more stress hormone, more cortisol makes that worse. But we also need, that's one of the things that MaxLove strives really hard to do, is over the last 10 years, as we've taught the culinary medicine classes, one of the really repeating themes is that if we can get nutrition in wherever we can during this time, that it reduces side effects, that it reduces it improves quality of life so that we can focus on that. When when we're going through these things, I think there is a rising tide of information that's being disseminated out to oncology teams that bone health starts, day one of treatment. Gut health starts day one of treatment, where those may not have been the focus in years past because we didn't have the data that we do now that those things are so important. But that's something that we can absolutely focus on, today. Um, that study that was in San Diego about the effect of gut health, they took siblings in the same family and they did a stool sample, and they did a stool sample from the child who was at home not going through treatment and then the child that was going through treatment, and they took it at the beginning and the gut diversity was the same almost, and the gut abundance of microbes was the same. And then as treatment went along, each time they took a fecal sample, a stool sample, they showed, the person detracting. And but also the diet starts to get limited when you don't feel like eating and you're throwing up and you feel really sick. And so how and what can we do about that? And it really depends on the kid, in terms of, is cold food better right now? Is hot food better right now? Do we need to puree things? Is there mouth sores? Things like that. So there's some consideration going into that. So having a dietitian that can troubleshoot these things is really, really helpful, to that. But a lot of the recipes in our cookbook are also designed to meet that need. So for example, green smoothies. When I think about the nutrition, and we'll step right into that for bone health at all times, is that we absolutely want to make sure there's enough calcium. So you hit that nail on the head. We also want to make sure that there's enough vitamin D, but there are sweet spots for these things. And so maybe 10 years ago, they would test somebody's vitamin D, see that it's really low, and they would give them a hyperdose. So they would give them 50,000 IU once a week for 6 weeks and try to get them up to speed. And I so sadly even had a patient once that was lost to follow-up. And so they were a year out and they were still doing 50,000 IU of vitamin D every week, all the way for an entire year. And when you do that, when you hyperdose a supplement like that, that is really integral to the bone process, you upset the apple cart. And you actually, because vitamin D is actually a hormone, so it can it's a transcript hormone and tells the body to do things. And when you hyperdose with it, it can throw all of that stuff off and actually become a detriment to the bone. So almost all practitioners have stopped that 50,000 IU recommendation. But that being said, calcium as well has a sweet spot to it. So the recommended daily allowance for calcium should not be exceeded by supplement doses. The very best way to get your calcium is from food. And the recommendation for a 1 to 3-year-old is 700 milligrams a day. For a 4 to 8-year-old, it's 1,000 milligrams a day. And then for your 9 to 18-year-olds, it jumps up to 1,200 milligrams a day. And so what that might look like is you get your most calcium from dairy products. And so a dairy product, whether it's milk or cottage cheese or yogurt, ranges anywhere from like 300 to 450 milligrams for an 8-ounce serving in milk or a 1-ounce serving in cheese. So it just depends on what you're eating. But generally, if you're getting 3 servings of dairy products in a day, you're getting enough. The problem happens when you have an impact to your gut health and you can't tolerate dairy anymore. So the other sources of dairy out there would be fortified foods, but usually those are more processed foods. If you can get them from whole real foods, that's the best. The dark green leafy vegetables, 1 serving will net you 100 milligrams. 1 serving of beans will net you 100 milligrams. 1 serving of nuts and seeds will net you about 100 milligrams. And a serving size for dark green leafy vegetables is a cup of raw or a half a cup of cooked. The serving size for the beans is a half a cup. If you're on a ketogenic diet, that's not going to be your friend, but nuts and seeds will, and that's generally an ounce. So almonds would be 8 to 10 almonds would net you about that. There are all kinds of other alternative dairy products out there. There's pros and cons to each one, but generally you're looking for one that's unsweetened and you're looking for one that's fortified with calcium. There is pills out there that you can take. You do really want to try to do it with food first. There are several different kinds of calcium that comes in supplements. Like, for example, calcium carbonate would be considered a cheaper form of supplementation. And those who have a problem with low stomach acid, and some people who have gone through oncology protocols do have a problem with low stomach acid for a while, not forever, but for a while, they don't process calcium carbonate very well. And so one of my more desirable forms of calcium is raw calcium that like the garden of I just lost it. It's nature's, what is that one, Sam, that I was talking about the other day? Do you remember?
I don't
I
know.
put it on the MaxLove app, and
Okay.
I could go downstairs and grab it as well, but because I use it too. But the name of the supplement is raw calcium, but the brand name I'll get back to you on. And then there's another one called Life Extension Bone Restore that has a mixture of different calciums. They have a little bit of calcium carbonate in there, but they also have calcium bisglycinate and other ones like that. So calcium, not over your max, because if you go over your maximum, not maximum, but if you go over the recommended daily allowance, that can affect heart health and can create kidney stones. Not over a maximum of vitamin D, because the vitamin D, if excessive, can then come back and create problems with bone health. It would be awesome if you could get vitamin D from food, because when you get vitamin D from food, you're getting so many or more nutrients as well, instead of just a synthetic form. But some of the highest sources of vitamin D from nature, salmon is a great source of, especially if it's wild and formed, because they lay down more of the vitamin D than something that has been farmed. And that would be about 200 IU. It's called IU international units, about the size of a deck of cards or the palm of my hand, is a 4-ounce portion of salmon, and that'll net you about 200 international units. The recommended daily allowance for vitamin D is just 600 international units. I tell everybody to test their vitamin D. Everybody should be testing vitamin D. All oncology across the country, different hospitals should be testing vitamin D, and that will tell you where you're at. So say, for example, the sweet spot, I think, in a lot of the research for vitamin D is between 50 and 80, and below 50 to 30 is going towards insufficient. But if you get a lab value for it, the lab will have on there that the range is 30 to 100. There are practitioners that don't agree with me. There are practitioners that think over 80 is more valuable. I have had several discussions with oncologists where a vitamin D level above 120 is actually something that has been hijacked by the cancering process, and so is not desirable to have. But that's more in the conventional world. I've spoken with integrative practitioners who believe that vitamin D in the 120 is more desirable. But most of the research I've seen shows an optimal vitamin D level to be between 50 and 80. So salmon is a great place to get it. Mushrooms are actually a great place to get it. So if you take mushrooms and you hold them upside down and put them in the windowsill and let the sun interact with the gills of the mushroom, that mushroom will actually make vitamin D, which is such a cool thing. And you can do it yourself. You can buy mushrooms and hold them up to the sun in the windowsill for an hour or two. And when you put them back in the fridge or you cook them, it doesn't affect the vitamin D content that they made. It's pretty cool that way, how nature works. But it also comes in fortified food, like your fortified milks and things like that, dairy, alternative dairy products. But you want to make sure that the D3 that's being fortified, not the D2, because the D3 is the active form and the D2 is not very well absorbable by the body. So that being said, you asked me specifically about the calcium and the vitamin D, but there are a whole bunch of other nutrients that are really critical to bone health as well. And vitamin K2 has been researched extensively in the last 10 years as something that goes right along with vitamin D and is needed to properly lay down bone. Magnesium is also really critical. And magnesium is something that is depleted with a whole lot of the chemotherapies as well. And again, there are several different types of magnesium, but the important thing to know there's 400 milligrams is about your top dose of magnesium that you want to take for a whole bunch of reasons. Over the top of 400 can actually create GI issues for you, loose stool. In fact, they give a pretty high dose magnesium to those people who are really impacted in the hospital that they want to create loose stool for. And there also are different types of magnesium that can create loose stool all by itself. So magnesium oxide or magnesium citrate creates a looser stool. There are some really helpful magnesiums that are actually very calming and are very helpful to sleep. And so magnesium glycinate is one of those. Some people pronounce that glycinate, so don't let that confuse you. But there's also magnesium threonate, which can cross the blood-brain barrier and be calming too. So it's the calcium, it's the vitamin D, it's the magnesium, it's the K2. But there's also some micro minerals, boron and strontium, that are important. And they're easy to get if you're eating a wide variety of foods, but they are in that raw calcium formulation, and they're also in the Life Extension Bone Restore formulation. Both of those are obtainable over the counter. You can get them at Sprouts Market, Whole Foods. I don't ever recommend buying supplements off of Amazon because there has been documented fraud for a number of years where people take the label, they put sugar pills in there and slap a new label on there, and they also have been reported not to do the care and concern that's required for supplements, keep them in temperature controlled facilities and things like that. So I always recommend if you can get it from a place that also has a pharmacy, for example, CVS and Rite Aid, those places are subject to more inspections than places that don't have pharmacies in them. So Targets, CVS, Rite Aid, those are good places to get supplements as well.
Or we could plug your full script too. I've used
Yes.
practitioners full script to just because sometimes the supplement market can be completely overwhelming on what to buy.
Yes. Yes.
So your full script too has been helpful just to find brands that are beneficial.
I'm sorry, but caveat on that one is that as a dietitian, it's outside of my scope to sell supplements. And so I provide it as a convenience for my clients, but I don't sell for a profit, and I don't sell for, I don't provide it as a thing. But any of your providers can absolutely have a full script account. So anybody that has any kind of a practice, so if they are your provider, you can get full script. Will have a huge selection of all different kinds of brands. They take great care and concern. They ship you things that are in cold packs, and it's a great service, especially if you're working with a professional who can direct you towards very specific brands, very specific types and dosages according to your child's individual needs. And then they can just put that in your full script band, and you can just mail order it and have it sent. So that's such a great idea, Sam. Such a great idea.
Yeah. And I just had one question about magnesium specifically. Is there because I get overwhelmed with the different types. I think even just buying products, you can read the back and be like, what's the difference between magnesium oxide or citrate? Is there one that's specific to bone health that, because I know even glycinate is for heart, right? Or muscular, that kind of relaxation. Is there one that's specific to bone?
Yes, there is. In a lot of studies, the citrate is one that is recommended for the bone health. Just realize that there also is some loose stool that can happen, especially at higher doses. Usually I have people start off with 100 milligrams and see how it affects their stool before they progress to 200 milligrams and then top out at 400. And that 400 top is lower for lower age groups.
And that's helpful because I think the calm powder And I
is
think they even have
oxide.
gummies. It's oxide? Okay.
Yes, yeah,
So
yeah,
that's different.
yeah, it is.
So looking in specifically to the citrate, that's helpful.
I have a question for you. So as a mom who definitely feels overwhelmed by the supplement world and the
Yes.
dosing and trying to figure out what would be best. I I often wonder, I know that a lot of these things are better to get from food.
Yeah.
But my daughter is 9, and as you were saying before, which I think is really common with a lot of people, is that gut issues become prevalent a lot of times with kids afterwards.
Yes.
And so she did experience C. diff, where so we know that
Yes.
her gut biome was impacted during it. But
Yes.
currently we're pretty sure that she might be lactose intolerant. So there are, and at getting a 9-year-old to eat mushrooms and salmon and green veggies, it's not as easy as I would want it to be. So I guess one of the questions I have for you is, a lot of times it's said that it's better to get it from food, and here are supplements. And so then I end up being left in the limbo of, well, I want to get it from the food, but how do I keep track of if I'm doing a good enough job
Good question,
actually
Jenny.
doing
Good
that?
question.
And then how do
Yeah.
I decide
How much
what
to make up the
dose to
difference?
do if it's better to do
Yeah.
it from the food and it's not a good idea to overdo it?
That's such a good question. There are free tools available to us that are so helpful, so incredibly helpful. There's one in particular called Chronometer, and that's not spelled with a CH, it's spelled with a CR. So it's CRONOMETER. You just need the free app. You don't need to pay for a subscription fee or anything like that. And what it does is it tracks not only fat, carbohydrate, protein, and the balance of that, but it tracks all of the different vitamins, all of the different minerals. It even shows you the breakdown of omega-3 and omega-6 fatty acids as well. And you don't have to track forever. It's just tracking for 3 days in a row gives you a really good idea of how closely you're meeting the different nutrients that you're looking to fulfill. But in addition to that, it has the coolest feature where you can hover your cursor over, say, vitamin D. And then not only does it say, okay, you got, say, for example, like you got 300 IU that day, it shows you what your biggest sources of the vitamin D were, but then it gives a list of foods that you can focus on that is going to increase that number as well. And then you can also play with the app in terms of, well, if I had a half a cup of mushrooms, how does that change my vitamin D number for that day? So you can use it as a great tool to not only see how much you're getting, but then see how much you need. And then on the back of every supplement label, or I should say most supplement labels, it'll tell you it takes this many pills to get to this high of a dose. And so, for example, 4 of those raw calcium pills gets you to 700 milligrams of calcium. And so if you say got on the chronometer that you were, close to 500 milligrams of the calcium in a day, then you need at least 2 of the supplemental ones to get you closer to your goal for that day, depending on your age group. So that's a really nice tool to figure it out. And it's not just a nice tool to tell you what you got, but it also tells you where you can get more. The cool feature about Chronometer that I like as well is that you can have a desktop. You can go into it, chronometer.com online, make yourself an account, and then you can have a phone app. So you can have it on the road, you can have it at home. It also has a barcode that allows you to just snap a picture of the label, and it'll dump all of the nutrition information into your app as well. So it's not like you're having to hunt and peck for all the different foods. And it does have a fabulous, inventory and data source of all the different foods. But that barcode is really convenient to just dump it right in, keep track for a couple days. There's a possibility of doing a 3-day trend report because we know that none of us eat the exact, well, you usually don't eat the exact same thing every day, but also that some days we hit it, some days we don't. So getting a trend of at least 3 days of information is going to give you more information about how to dose those supplements so that you can get it in. The other part of the answer to that question is that all of this is a process. When you go through chemotherapy and you're as sick as you are, and you've found 5 foods that work for you, there's an emotional part of that. This is where I'm safe, and over here I'm not safe. And so when you're getting into survivorship and you're getting into that space where, okay, I can maintain now, I'm better now, you want to be safe. You don't want to go out here on the edge and tackle some of this new stuff. And so, even with a child who hasn't gone through some of these issues, studies show that it takes 16 times of introducing something before it's accepted. So then, when you're coming from here, where I'm safe here and I don't want to leave here, it's probably going to take more than 16 times. So, patience is huge, patience is key. Use the supplements while you need them. And then, slowly work through all the processes that we talk about in MaxLove to get that acceptance going. And I don't know if you've heard me talk about this before, Jeni, but there's 5 stages to acceptance. And because it takes longer than 16 times to make it through these 5 stages, it can require a ton of patience. And so the first stage is just allowing that food in your environment. So trips to the farmer's market, trips to people talking about it, people who are excited about that kind of food, seeing it on the dinner table, that might be just enough to get that first stage of exposure into it. And then you can be encouraged and say, would you like to try it? And don't have it be a battle about, you have to try this, because that doesn't get acceptance usually. But if somebody says to you, no, I don't want to try it, say, would you like to smell it? And try to get their curiosity going. So smelling is the second part of that. And then the third part about that is allowing it anywhere near their mouth. So letting a child have the confidence and be safe to know that they can experiment it without having to eat it. Would you like to lick it? Would you like to hold it in your mouth for a little while? And that would be one of the few times that I would say that it's okay to spit something out and let it be okay. No, I don't feel safe swallowing it now. I just want to have it be in my mouth for a second. And then you get to swallowing. So it's a stages of acceptance that may take a while. I have seen some kids where it takes a few years to get to a place where they're eating the 5 to 8 recommended servings of fruits and vegetables in a day that are going to net you all of these different nutrients. But try to focus on places where there is some common ground. If your child eats peanut butter, you're getting the nuts, you're getting some zinc, you're getting some vitamin E, you're getting some of those nutrients that are peripherally important to bone health. And that's good. See if they'll eat a whole peanut after that. See if they'll graduate to an almond. See if they'll do a sunflower seed or pumpkin seeds, which are higher in magnesium. And try different forms. So if it's the crunch that's bothering them now, maybe there's some bone health, dental issues, maybe there's still mouth concerns, that scary part where you had mouth sores once and you don't like crunchy foods after that. And then you go with nut butters or seed butters. But trying to change the form and change the texture and just do things associated with food so that it's in their environment is something that can help.
I know one thing that we've thought a bunch about, have yet to implement, but is the idea of kind of doing some smoothies because
Yes.
you can sneak some of this stuff in there.
Absolutely.
And so one of the questions I have for you about that is, since we're facing potentially lactose intolerance, are there other alternatives to milk that you think are better specifically for bone health and survivorship if somebody isn't able to do milk in a smoothie or
Yes. And there's good, better, and best, without a doubt. We have in the cookbook, we have a whole spread on different smoothies, and we have, I believe, 5 different flavor profiles for the smoothie. But we also have a whole article in the cookbook that talks about all the important parts of smoothies that are really important to remember. And so, the first part of that is the liquid base. So are you just going to use water? Are you going to use dairy? Are you going to use coconut milk? Say if you're trying to support a more ketogenic diet, is calcium the issue you're focusing on? In which case, is dairy going to do it, or do you need to go with an alternative product? And if you need an alternative product, then we launch into a discussion of, do you need weight gain or not? Because there are some alternative milks that really have almost no calories at all to them. Like, for example, oat milk has like 60 calories in an 8-ounce cup versus macadamia milk has a lot more to it. You also think about fortification. What type of calcium was fortified, or was it fortified? Most alternative calcium products, dairy products, are fortified, but still check your label and make sure. And what's it fortified with? Does it have calcium? Does it have vitamin D? Does it have magnesium? Does it have K? Because some of the higher end, I should say, uh, uh, styled alternative milks have a lot of these different fortifications in them, and are really of the more quality ones to look for. The caveat to that is that we know we're dealing with gut health issues with all of our kiddos. And so a lot of these alternative milks also have guar gums and other gums that are gel-on gum. One particular ingredient that you want to stay away from is an alternative milk product is carrageenan, which is a seaweed product, which is absolutely documented to cause more gut health problems. And so you don't want to trade one, I'm trying to get the good calcium in for now I'm loading up with all these other nutrients that are going to impact gut health too and make somebody uncomfortable. So the alternative milk world is vast. I used to work in a food allergy clinic where I kept a huge spreadsheet on all these different alternative milks, which one's fortified with what, which had the better calories, which had the more anti-inflammatory fat. If you're going for anti-inflammatory fat, maybe your hemp milk is a good idea. But they also change all the time. So it's like I have to read the labels each time, and my spreadsheet was quickly outdated. So there's lots of considerations there for the base form of the smoothie. But the other important part of the smoothie is balance. And so you don't want one that's 90% fruit and you just consumed, 12 servings of fruit all in one sitting. And so it dramatically raises blood sugar. You want some protein in there. You want some good healthy fat in there. And then you would like to have some veggies in there. And so when I make a smoothie for myself, I'm putting in, I'm filling dark green leafy vegetables up huge, but I'm also adding, one of our sponsors makes a grass-fed beef protein powder that's absolutely delicious and really a ton of protein in a small serving size. So one scoop nets you 22 grams of protein. And so it depends on the age of your child, how much protein that you're going to need, but protein in there, a good healthy fat in there to do satiety and also balance out that blood sugar. Maybe it be just slices of avocado, maybe it be coconut milk, something like that. The coconut milk in the dairy alternative is not going to have much fat, but the coconut milk in the can is going to have a lot more fat to it. But then the one in the can is not going to be fortified. So I know I'm kind of talking in circles here, but there's a lot of factors to consider when you're picking out an alternative milk if you can't handle dairy. Did I answer your question, or did I go all the way around it?
Well, I think so. I kind of want to pin you down and be like, if I had one, what would be
If you
best
had
for bone health? If
for myself, and I do
challenge.
have problems with bone health because osteosporosis is not only huge in my family, but it's also huge in my genetics. And that was another thing that I wanted to talk about today. But I use temped hemp milk. And the reason why I use it is because it's anti-inflammatory. It has more of the anti-inflammatory omega-3 fats to it. It's fortified with the calcium that I like and the vitamin D. But again, I'm older and I don't want as many calories, so it doesn't have a lot of calories to it. So for me, that is the one that I pick. There's also a flax milk that has a lot of omega-3s in it. That is good. They have a high protein one. The high protein source is pea protein, which in my opinion is not a super high quality protein to build muscle with, but that is the protein source that's used in that one. If I had all the money in the world, I would make, and the time in the world, I would make my own almond milk, and then I would add a liquid calcium and vitamin D supplement to it.
Um, and actually, before we finish this just reminds me that I have talked to a couple people where, and it's kind of going back to the supplement place, but who were actually taking the vitamin D3, and it wasn't helping so much. And then I heard that there's like a liquid form that maybe if that can that often will get absorbed a little bit better. Are you maybe under the tongue or something of that sort?
Yes, yes.
Could you talk a little bit about that? Because that wasn't my personal experience, but there's been a few people I've spoken with who have discovered that, and it was helpful for them.
Such a good point. Such a good point. Because, like we talked about at the beginning, it's multifactorial what leads to bone health. One of the things we didn't talk about yet is genetics. And at MaxLove, we have a nutrigenomics program where we look at the genetic variances that predispose you to certain conditions and that are modifiable by nutrition. So it's a program we hope to build over the next couple of years. And there are three genetic variances in particular that affect the way your body lays down bone. And one of them is called the VDR genetic variant, so vitamin D receptor. And so you can take in the vitamin D that you need, or your body can make it, but you have receptors all over your entire body that the vitamin D attaches to, and one of them is on the bone that tells your body to lay down more bone. And so if you have a vitamin D receptor problem, the liquid vitamin D underneath the tongue might be more advantageous for you in order to absorb your vitamin D properly if you have one of these vitamin D receptor variances. And so testing, not guessing, is a great way to do it. And something so important to know here is that when you supplement with liquid vitamin D, or if you're fine with taking oral vitamin D in a capsule, that vitamin D that you just supplemented has a half-life of 15 days. So if you take a vitamin D test, say a couple days after you've just ingested that vitamin D, it's going to give you a readout more of what you've been supplementing than what your actual body stores are. And so it's really advisable to stop doing vitamin D supplementation for the 2 weeks before you get the blood test, because that will give you a more truer example of what your actual vitamin D status is. I've had people who forgot about that important caveat, and they've gone and gotten their vitamin D tested, and it's been 120, 130. So it's been more reflective of the supplement they just took. And then their doctor is like, whoa, you need to slow down on your vitamin D supplementation. Then they won't take it for 6 months or a year. We'll retest it, and then they'll be in 20, or 30. So it's really important to stop doing the vitamin D supplementation before taking a test. Going back to genetics, there's other genetics that affect the way bone is laid down in your body that are reported on this nutrigenomic report that we can offer. One of them is a collagen genetic variances that affect the way your body produces and lays down collagen. And that's an important part in the matrix of bone health. There's also another one that's called an estrogen receptor. And estrogen is one of the sex steroid hormones that makes a difference in the way your body lays down bone. And so if we have receptor variances on the bones, that can also affect. And we know chemotherapies affect luteinizing hormone, follicle stimulating hormone, all of the gonadotropins that create hormone stability in the body.
And it kind of a last note too. I have also spoken with people who their oncology team has requested a blood test for calcium, and the test itself came back normal. And then in kind of later discussions, they found out that that actually is not indicative necessarily of their bone levels, just because the blood test comes back normal. Could you talk a little bit about that?
Yes.
That
Yes. Calcium levels are absolutely critical to keep a heartbeat functioning normally. And so the body will do everything that it can to keep calcium in a normal range in the blood, because that calcium is important to how the heart beats. And so what it will do is it will steal calcium from the blood in order to make that number exactly what it needs to be in the blood in order to support the heart. It'll use the heart as a priority organ, and it'll use the bones as a storage depot, basically, for stored forms of calcium. So the truest way to identify what is going on with calcium levels in the body is doing a DEXA scan. And the World Health Organization, they will do the DEXA scan. They have devised a system of what's called T-scores to tell you what the results of the DEXA scan mean. So anybody that is in the range of a -1 and above is considered to have normal bone. Somebody who has between a -1 and a -2 is considered to be going towards osteopenia, which means low bone mass. Greater than a -2 is considered osteosporosis. Greater than a -2 with some bone fractures is considered more a necessary feature for treatment. So there are several conventional treatments that are available out there, several different conventional medications. That's probably not the scope of this conversation, but I do have patients that are on that type of medication. There are several, but I really like to focus, like we talked about, on food and lifestyle too. We didn't get to the exercise piece today, but I think that the bottom line for the exercise piece is to go with a knowledgeable practitioner. So if you've got a -2.5 with fractures, that utilizing a PT who is skilled, a physical therapist who is skilled in osteosporosis, is a great way to go, because they can design effective treatments that are individualized to you that involve that exercise piece. But weight-bearing exercise in general for everybody else is important. Higher weights, lower reps, HIIT training, those are really, really valuable to bone.
And for those families who, like my daughter, who ended up with osteoporosis in the leg after not being weight bearing on that leg, is it generally recommended to do the systemic scan to make sure it's not systemic, or is once you find it in one part, I guess I wonder if we should be exploring other parts, or is it pretty common for it to just stay in one bone area?
That's a great question, Jeni, and it does become a balance issue in terms of how much exposure do I want my daughter to have to scans, additional scans and things like that, and what is the benefit versus risk ratio? Is knowing what the levels that your daughter is advantageous and going to define what is the best treatment, and how does knowing that outweigh the risks that doing additional scans will impart? In my opinion, if you've already had a fracture, knowing what's going on in the spine, knowing what's going on in the hips, the knees, the other major joints in the body would be helpful to define treatment. But the correct doctor to see for that would be an endocrinologist. And then he would take I haven't actually seen your daughter's medical records, so I don't have all of them, but he would take all of that into a consideration with you. And it would be good to have hormones checked as well. I think that would be an important feature. Of fasting morning cortisol would be also really valuable, because alterations in cortisol can persist past the initial event of the chemotherapy's treatment. So I think all of that is really useful to the determination of, what should our next steps be? What is our pros and our cons and things like that? And an endocrinologist can help you figure that out.
And then I guess kind of pinning you down just like on the milk, like I did with the milk.
Yeah.
If we wanted to take a supplement that is just a kind of overall bone health, so instead of buying each one separately, if there was one, I know that everybody's different and it is better to get it from food, but is there kind of one that you throw out there that you recommend?
Over the counter, and I finally remember the name, Garden of Life is the brand, and the type is called raw calcium. They do have one that's called a raw calcium elite that has a lot more strontium. I think that would be a negative in a child. So just go for the basic raw calcium that's made by Garden of Life if she can swallow pills. If she can't swallow pills, there's a brand that has a set of liquid supplements. You have to get them in two different ones because they don't have one in a complete package. But Mary Roos is the brand. You can get that online directly through Mary Roos, not through Amazon. But they have one that's called a multi-mineral that has a couple of the minerals, but then they have a D3K2 that's separate, and both of those are liquid. But anytime you're taking liquid too, you want to remember to take it with food and with a source of fat because it helps the liquid to be absorbed better. You're so welcome. I hope that was helpful. I know that some of these types of things will spawn more questions, and we will try to answer those in the app as well. Or if there's a lot of questions going in a particular direction, maybe we'll even have a different topic on it for a podcast.
Yeah, I think this is all really great, and I appreciate you, Lexi, allowing Jeni to pin you down, as she says. I think that's what we as parents like really want, you know, from experts to be like, just something small, actionable, like, so I'm not sifting through endless amounts of information. So I appreciate you showing up and being able to answer some of those questions. And like you said, if this sparks any more questions for anyone listening, there is the ability to comment in the MaxLove Project Connect and just hashtag ask the expert. And someone from our team will be able to kind of filter those questions over to an expert and answer it in the app, or like in this podcast, we were able to kind of bring those questions that are being talked about in the app and kind of get more direct answers from Lexi in an easier format for her as well. So this will be an ongoing series. So even if you have questions outside of bone health, anything that is on top of your mind, nutritional wise, feel free to share, because when you share, you're not only helping yourself, but you're helping other people who are also looking for this type of information. So it's all part of the community building as well. Jeni, do you have anything to add to that?
No, I just want to say thank you so much. That there's a lot to balance after you go through so much, and then where I am now, like, thank God we're in survivorship, and there's still information to be sought out, and we want to try to support our kids. And we're also, for anybody out there who is being harsh on themselves, I always like to say, like, that we're all, just getting information and doing the best we can little by little.
Yeah, what is your saying, Lexi, that you said in a previous episode? Don't let perfection be the enemy, right?
Absolutely. Absolutely. Yeah. I think that there's a lot of information out there. And I think about me as a person who, first of all, is a geek. I read studies all the time. I amass all this information, but then in an episode like this, I'm trying to give value and I'm trying to get it all out there and I'm trying to give all this information, but somebody who's listening might be like, there's too much. I need to pull the hood over my eyes. I can't possibly put all this stuff into play right away. And it is absolutely overwhelming. And usually at the end of a talk, I say to somebody, let's pick three things. Let's pick three things out of everything I've talked about. And let's just do just those three things for the next month until we get them into a role. And so if anything has resonated with you during this talk where you're like, oh, I could do that, that would be something that I could absolutely put into play right away. Maybe it be the chronometer. Maybe let's just be aware of how much we're actually taking in. That might be something that you might pick. Or it might be, I'm going to set up an appointment with the endocrinologist and I'm going to see what they have to say about whether a scan is a good idea for my child or not based on everything else. You know what I mean? And let's go talk to an expert who has access to my child's medical records and can really tailor specific recommendations. So just pick three things. And then this episode will be recorded. You might listen to it again in the future and say, oh, there's another thing I'd like to add. You know what I mean? So
No, I appreciate that. I
I
think
think
that's
that's a good
really
way to
actionable.
go
That's
about
probably the
it
most
too.
actionable is just like prioritize,
Yeah,
grounded
yeah,
in the decisions you make and
yeah.
just only take what you can handle. Meet yourself where you're at.
Yes.
Yeah.
Yes, because just those steps is going to make a difference.
Yeah.
And so, you don't have to take every single thing and incorporate it right now, but take some things that resonate with you and try to pick one, and that'll just send you down that path,
Mhm.
and then one foot in front of the other.
All right, Lexi. Well, we appreciate you so much. And this is the first episode of many where we can kind of pick your brain, your expert brain. So we really appreciate you.
Absolutely. It was great to talk to you, and I'm really grateful for the platform and to be able to talk to families this way because we can
Yeah.
reach more people.
Awesome. Thank you so much, Lexi.